Different types of consents. In the field of medicine, obtaining consent from patients before conducting any medical procedures or treatments is of utmost importance. Consent is an ethical and legal requirement that ensures patients have the right to make informed decisions about their health care. There are several types of medical consent, each with its own purpose and implications. Let's explore them in detail. Implied consent. Implied consent is an unwritten form of consent where the patient's actions or behavior indicate agreement to a procedure or treatment. It is typically used for routine procedures with minimal risk or when urgency prevents obtaining explicit consent. For example, if a patient extends their arm to have blood pressure measured, it implies consent for the procedure. Verbal consent. Verbal consent involves the patient providing oral agreement for a specific medical procedure or treatment. This type of consent is often obtained in routine medical consultations, minor procedures, or examinations. While verbal consent may not be legally binding in some jurisdictions, it serves as evidence of the patient's willingness to undergo the procedure. Written consent. Written consent involves the patient signing a document that outlines the procedure, its risks, benefits, and alternatives. It provides a clear record of the patient's informed decision and protects both the patient and the healthcare provider. Written consent is typically required for invasive surgeries, complex procedures, or research studies involving human subjects. Informed consent. Informed consent is a comprehensive type of consent that ensures patients are fully aware of the procedure, its risks, benefits, and alternatives before making a decision. Healthcare providers are responsible for providing clear and understandable information, answering questions, and ensuring the patient comprehends the information. Informed consent is an ongoing process that requires active communication between the patient and healthcare provider. Consent for minors. When dealing with minors, the consent process becomes more complex. In most jurisdictions, minors are not considered legally competent to provide consent for medical procedures. However, there are exceptions for certain treatments or situations where a minor's consent can be obtained, such as reproductive health services or emergencies when parental consent is not immediately available. The specific rules regarding consent for minors vary across different countries and states. Advance Directive. An advance directive is a legal document that allows individuals to express their healthcare preferences in advance, usually regarding end-of-life care. This type of consent outlines the patient's wishes in situations where they may become incapacitated and unable to communicate their preferences. Common examples of advance directives include living wills and durable power of attorney for healthcare. General consent. General consent, also known as blanket consent or standing consent, refers to a broad form of consent given by a patient for routine and commonly performed medical procedures or treatments. It is usually obtained at the time of admission to a healthcare facility or during the initial consultation. General consent allows healthcare providers to perform routine procedures without having to seek explicit consent for each individual instance. When a patient gives general consent, they are essentially authorizing the healthcare provider to perform routine procedures or treatments that are deemed necessary for their care. These may include actions such as taking vital signs, drawing blood for diagnostic tests, administering medications, or performing routine examinations. General consent is typically obtained for non-invasive or minimally invasive procedures that carry minimal risk and are part of standard medical practice. It simplifies the process for routine procedures and helps ensure timely and efficient care for patients. However, it is important to note that general consent does not cover major or high-risk procedures, invasive surgeries, or experimental treatments. For such procedures, specific informed consent is always required. Emergency consent. Emergency consent allows healthcare providers to perform life-saving procedures or treatments in critical situations when obtaining explicit consent is not feasible. It is based on the principle of implied consent or the assumption that a reasonable person would consent under similar circumstances. Examples include performing cardiopulmonary resuscitation, CPR, or emergency surgery to save a patient's life. Research consent. Research consent is specific to participating in clinical trials or research studies. It involves providing detailed information about the study's purpose, procedures, potential risks, benefits, and confidentiality measures. Participants then provide their informed consent, acknowledging their voluntary participation. Research consent follows ethical guidelines and regulations to protect participants' rights. It's important to note that the specific requirements and regulations for obtaining medical consent may vary depending on the country, state, or healthcare institution. Healthcare providers must adhere to the legal and ethical standards of their respective jurisdictions to ensure proper consent is obtained and patients' rights are protected.